Hello, my name is Bethany Crain and I am an occupational therapist. Part of my job is to assist in educating you on home safety and make sure that you are able to eliminate any safety hazards that may be surrounding you in your home. By doing this, we hope to ensure that you can go home as safe and independent as possible. If you are having difficulty with independence in your home, the following tools may be helpful. First, I want to start with the bathroom area because, although it is a small space, shockingly enough, this is the number one place individuals experience falls. It is extremely important that you take the time to back up to the seat until you feel the back of your knees touch it before sitting down. This will allow for you to make sure that you are close enough to the toilet that when you sit down, your body will be in a safe position. Another important aspect of the bathroom is the shower. Everyone's homes are different, so depending if you have a walk-in shower or tub shower, this may depend on the type of equipment that is suggested. Consider trying to get in the shower while dressed with a caregiver present just to try it out first. If having trouble with transfers, I would definitely recommend grab bars and a tub bench. The grab bars assist with transitions into and out of the shower, as well as offer something to grab onto when in need. A tub bench is good to have because it gives you the option to either take a shower seated or sit down at the times you may be feeling fatigued. Here are a series of videos that show how to properly get into and out of a shower. Whether you have a tub shower or walk-in shower, it is extremely important to always lead with your strong leg first, followed by the surgical leg. The next room I would like to discuss is the bedroom. One of the biggest recommendations for the bedroom is to place night lights. These are good in case you have to get up in the middle of the night to go anywhere, such as the restroom. The extra light allows for you to better see where you are going and to prevent any falls. Another good tip is to make sure your walker is placed next to your bed so that you have it ready to go when you want to get up. Although not related to home modifications, one of the most important things following an orthopedic surgery is how you dress yourself. Unless your therapist tells you otherwise, there are no precautions that you need to be aware of. Although the reacher can assist with dressing, such as making adjustments to clothing, it is more so used to assist with gathering items and bringing them closer to you. It is important to only reach for things that are no more than one arm's length away to ensure your safety. If you can't reach down to your feet, the sock aid is a device that assists you with putting your socks on. What you do is you slide the sock on the device and while holding onto the ropes, toss it towards the ground. You then slide your foot in, pull the ropes toward you, and your sock should then be on your foot. If for some reason it does not go all the way on, you can use your reacher to adjust it. The long-handled shoehorn is used when you are putting your shoes on. The extra length on the handle again eliminates you from having to reach down. All you do is place it inside the shoe at the back of the heel and slide your foot in. Finally, the long-handled sponge can be used when showering. It is helpful for you when you need to wash your back and/or lower legs. Getting into a car post-surgery can be a little difficult depending on what type of vehicle you may have. It is important that you sit in the passenger seat to allow for an easier transfer. Before getting into the car, have your caregiver make sure that the seat is pushed all the way back and the seat is reclined. Then, walk to the car door opening using your walker and turn so your back is to the car. Slide your surgical leg forward, grab the ceiling door handle, and slowly lower into the seat. Finally, swing one leg in at a time into the car. A peripheral nerve block is when an anesthesiologist injects a local anesthetic to numb the shoulder or arm. The nerve block can last several hours or up to 2 days. They cause feelings such as numbness, weakness or inability to move your arm, tingling, or feeling like your arm has fallen asleep. After a nerve block, you cannot feel pain, pressure, or extremes in temperature, so it is very important that you be sure to protect your arm to prevent any potential injuries. Some tips include changing the position of your arm to eliminate the amount of pressure on the joint, protecting it with pillows to avoid rolling on it when sleeping, and checking the color of your fingers ever so often to make sure that they are not turning purple. After a shoulder replacement, your doctor may give you a sling to wear following your surgery. To put on the sling, you should detach the shoulder strap. Place your affected arm in the sling with your elbow as far back in the sling as it can go. Secure the front panel by pulling the shoulder strap through the ring and attaching it to the Velcro. It is important that your arm be resting at a 90-degree angle. In general, prior to going home, it is important to have someone make sure that all rooms are free of clutter, cords, and rugs. If you do not have anyone to go and check for you, make sure that this is one of the first things you do when you get home. All walkways should be cleared to ensure a safe pathway at all times. You should also make sure that all areas of the house are well lit. At night, you can do this by either adding night lights around the house or leaving some lights on in different rooms. Last but not least, as I mentioned earlier, when sitting down on the toilet, side of the bed, or chair, it is crucial that you back up enough until you feel the furniture touch the back of your knees prior to sitting down. This alone can help eliminate some unsteadiness when changing positions. I hope that you were able to learn a lot from this video and as a result are going home feeling more safe and prepared. Although sometimes it can be frustrating to take the extra time to be cautious, in the long run it is far more beneficial to your overall health. If you have any further questions, please do not hesitate to contact your occupational therapist who will be more than happy to help assist you. Thank you so much and have a great day.